Welcome to the Focus series. I am Dr. Gopal Krishan Jalwal. In this video, I am going to demonstrate how to insert the pulmonary artery catheter or Swan-Ganz catheter. Pulmonary artery catheter, commonly known as a Swan-Ganz catheter. It is flow-directed balloon tip multilumen catheter. What does it mean? That balloon at the tip of PA catheter allows the catheter to float along with the blood flow. That's why it is called flow directed balloon tip multilumen catheter. It can be inserted by any central vein, either by IJV or subclavian. Then it passes through the RA, then RV, and ultimately goes into the pulmonary artery. So it provides the advanced hemodynamic monitoring. So what we can measure from the PA catheter? First, we can measure the CVP. So through the CVP, we can know the fluid status into the body. And second, we can measure the pulmonary artery pressure. So pulmonary artery pressure is indicated into the CABG surgeries or where we are suspecting pulmonary artery hypertension. Third, we can measure the pulmonary capillary wedge pressure. Through the pulmonary capillary wedge pressure, we can differentiate the cause of the pulmonary edema. Either it is because of cardiac origin or the lung origin. Fourth is the cardiac output. We can measure the cardiac output through the thermodilation technique. And fifth one is the mixed venous oxygen saturation. Mixed venous oxygen saturation is helpful in the septic shock management. So the PA catheter provides the detailed assessment of cardiac function and the pulmonary circulation. So this is the introducer set 8.5 French through which we insert the PA catheter. So let's see what does it includes. Here you can see the guide wire, and second one, this is a white color introducer sheath and blade and 5 ml syringe. Okay, and this black color is the dilator, and here you can see the transparent sheet to cover the PA catheter to maintain the sterility, and this is a puncture needle. Okay, first we have to check the patency of the introducer sheath. Here you can see okay, it is fine, and then we have to insert the dilator into the introducer sheath. So now it is ready. Now open the second covering. uh, so in this covering you can see the two items. One is the PA catheter and second one is the 1.5 ml Luer log syringe. So this is a PA catheter and Luer log syringe, 1.5 ml Luer log syringe. So this PA catheter has 110 centimeter length or 7 French for the adult size. So this PA catheter has few markings. Here you can see a thin black marking that belongs to the 10 centimeter from the proximal end, and this is a 20 centimeter marking, this is the 30 centimeter marking, 40 centimeter, and this broad black marking belongs to the 50 centimeter. So now this is for the 60, 70 and 80 centimeter, 90 centimeter and 100, and total length is 110 centimeter. And PA catheter has so many lumens, so I will explain one by one, and we will check the patency of these all these ports. So so now this first red color small port is balloon inflation port. First we attach the 1.5 ml Luer lock syringe. So here you can see the red color marking. Above and below red color marking should be in the same line. Then you can inflate the balloon situated at the tip of PA catheter. So it has lock system. When you push this on opposite side, then it is locked and balloon is still inflated. To deflate the balloon, you have to push on the same side, and then balloon is deflated. Okay, so now come to the second port. So here you can see a white color port. This is a proximal infusion port. Through this you can give the fluids, and this proximal infusion ports open into around 30 centimeter marking from the proximal, and when catheter is inserted, its opening lies into the RA. Okay, and now next port, here you can see the blue color. So blue color port is used for the CVP measurement, and while the measuring the cardiac output, you have to push the cold saline through this port. It also open around the 30 centimeter, and its opening lies into the RA when catheter is inserted. And next port is a yellow color port. Its opening is on the tip of the catheter, and it is used for the PA pressure measurement. Okay, and last here you can see the red color capped port. This is for thermistor, and it has few pins inside the cap. So here you can see. So it is attached with the lead, and through this we can measure the cardiac output, and from proximal to around 4 centimeter, there is a filament lies inside the PA catheter, through which we can measure the temperature variation for the cardiac output monitoring. Now insert a PA catheter in transparent poly sheath for the sterility purpose. Now our catheter is ready. So after all aseptic precautions, now we have to prepare for the IJV puncture. So here I am using the high frequency linear probe, and you can see the carotid and IJV on the ultrasound screen. So IJV is compressible structure, and you have to puncture it through the puncture needle. And here you can see my needle, and it has punctured the IJV, and you can see tip inside the lumen. And then you have to check the free flow of the blood, and guide wire is inserted through the side port while holding the puncture needle firmly. Okay, so now remove the puncture needle while holding the guide wire, and now we have to take the second puncture over the IJV for the introducer set. And here you can see needle tip inside the lumen. and free flow of the blood. Then insert the guide wire through the puncture needle. So the second puncture is for the introducer set and first puncture is taken for the CVP line insertion. Okay, so the two guide wire you can see. So we have to make a small nick over the insertion point. Okay, so now we have to insert the introducer set while dilator is inside the introducer sheath. You have to hold the dilator and guide wire both into the left hand and then push the introducer sheath into the IJV. Here you can see the free flow of the blood, and then you have to insert the CVP line over the second guide wire. So you have to insert the pulmonary artery catheter till the mark of 20 centimeter. So when you will advance it till the mark of 20 centimeter, it will reach into the right atrium, and you will see this waveform. So this waveform is just identical to the CVP waveform, where you see the three peaks A, C, V and two descents X, Y. So normal right atrium pressure is 0 to 8 mm Hg, and then you have to inflate the balloon, and you have to further advance the PA catheter. So when PA catheter will reach into right ventricle, so you will see waveform has been changed, because right ventricle has the systolic pressure 15 to 30 mmHg and diastolic pressure 0 to 8 mmHg, but without dacrotic notch. So here you have to further advance your PA catheter. So when it will reach into the pulmonary artery, you will see that diastolic pressure has been up. Okay, so and the waveform also changed. So in the PA catheter, you will see the waveform with the dicrotic notch, and diastolic pressure will be raised from 0 to 8 mm Hg to 4 to 12 mm Hg in the pulmonary artery. If diastolic pressure is more than 20 mm Hg, then it is known as a pulmonary artery hypertension as per the new guideline. So then you have to further advance the PA catheter, and when it will reach into the one of the branch of pulmonary artery, then you will see the waveform has been changed, and this reading denotes to the pulmonary capillary wedge pressure, and normal range of pulmonary capillary wedge pressure is 2 to 12 mm Hg. This white one is a introducer for the PA catheter insertion. First we have to connect this port for the zeroing. Just connect this port. Okay. Flush it and do the zero. Flush it. Okay. So do the zeroing numerator. Okay. So it is a zeroing. Let's focus on this side. Okay, so we have to insert this PA catheter in 11 o'clock position, so not in 12 or 1. Okay, so in 11 o'clock position. Okay, okay. So now I am going to lock the sheath and first introduce this catheter till the mark of 20 centimeter. Okay, so now you have to inflate the cuff and lock it. Okay, so okay, so at the level of 20 centimeter, so our catheter is in a right atrium. So this finding belongs to CVP. So now we will advance our catheter further after inflating the balloon. So now our catheter is at mark of 30 centimeter. Here you can see the systolic pressure has been up. Now we will further advance our catheter. So now you can see the waveform has been changed when we reach at level of 45 centimeter. So here you can see the diastolic pressure has been up. Now in the RV it was 8 mmHg and now it is 17. And waveform also has been changed. Here you can see the dichrotic notch. So now we are in a PA catheter and then deflate the catheter. So now we have deflated the balloon. So this is a pulmonary artery pressure. So if you advance further, then you can see the pulmonary artery catheter is placed into one of the pulmonary artery branch and it is wedge. Now this reading belongs to the pulmonary capillary wedge pressure, and when you deflate the balloon, then again you can see the it is measuring the pulmonary artery pressure, and here you can see the dichrotic notch. So if you again inflate the balloon, so then you will see okay, so now you can see that waveform has been changed, and this is a pulmonary capillary wedge pressure reading. So now here we have to withdraw the pulmonary artery catheter slightly and then deflate the balloon.